The Bill and Melinda Gates Foundation recently released its 2018 annual letter. The letter reveals the progress and challenges in global health and development and addresses some frequently asked questions regarding the foundation's work. I spoke to Haddis Tadesse, Ethiopia's Country Director for the Bill and Melinda Gates Foundation, and asked him the significance of this year's annual letter.
This year's letter focuses on 10 tough questions. It helps us sort of examine our work more closely and be transparent about what kind of things we're involved in.
Would you tell us about some of the questions that related to Africa?
At least 4 or 5 questions, maybe even 6 questions out of the 10 are actually relevant to Africa. Those around values, about overpopulation, about how we work with business and the influence that we have are very relevant questions to Africa.
What are those values?
Behind the question is probably, and I'm speculating here, is probably the idea that, you're Western, you're Americans, are you trying to impose Western or American values on people in Africa?
Okay.
And the reality is actually not that. What we care about, what we work on, are actually values that Africans care deeply about. We're talking about survival of children. We invest heavily in preventing diseases like malaria, TB, diarrheal diseases on children. We help farmers produce enough food to, support themselves and take the excess to markets. We believe mothers should not die giving birth. We believe HIV should not decimate our communities. So these are not, American or Western cultures. I think there are values that we as human beings share.
How does this reflect in Ethiopia?
As you know, Ethiopia has a very large population, over 100 million people, and the disease and poverty burden in Ethiopia is fairly large. Although Ethiopia has made tremendous progress over the last 15 years or so, we still have a lot of people who require assistance or who can benefit from some intervention. So we work particularly in health and agriculture sectors. In the agriculture side, we work with smallholder farmers to support them to produce more outputs and try to link them to markets both locally and internationally. So we're about sustainable productivity in the agriculture side. On the health side, we really focus mostly on mothers and children. So the survival of children under 5 and mothers is important to us. But then there are some other diseases, killer diseases like malaria and TB and HIV and some diarrheal diseases. And we think these are things that Ethiopians and Africans in general are trying to address. And, while we're providing significant support, we're a fairly small player in the biggest, thing. The biggest, contributors to this are usually government, and then if you take the donor landscape in general, they put a lot more money than we do. So we think we have the ability to support some interventions in these areas, and we continue to do that.